have a show of hands? How many of you have been asked that question in the last 24 hours? Very few. And how many of you answered, I'm fine, without even thinking about it? Most of you. I'm a doctor, so asking the question, how are you, is my bread and butter. I must ask that question 20, 30 times a day. So when I was asked in 2019 to attend a conference in an Alaska Native community on how to talk to people, I pretty arrogantly thought, you know what, thanks, but I think I've got this in the bag already. Little did I know. My mum tells me that I learnt to say my first word before the age of 1, but I would now say it wasn't actually until the age of 32 that I really learnt how to talk. And when I say learn to talk, I mean learn to ask that question, how are you? To mean it, to listen to the answer, and to know how to respond to it. Since starting my GP training, on asking patients that question, how are you, or how can I help you, I increasingly hear things like, I'm lonely, I'm struggling financially, I'm having problems in my relationship. And in medical speak, we call these kind of problems psychosocial. Now, GP Katie Musgrave recently wrote an article speaking to this, particularly speaking to the unsustainability of the NHS to continue seeing patients with this problem. Now, you won't be surprised to hear that the Twitter response to her article was ferocious, with readers including other medical professionals calling her callous, lazy, at the mere suggestion that patients might be turned away. Now, I don't bring up Katie's article to condemn her or to defend her, but simply to say that she does have a point. We do have a problem. In the UK, post-pandemic, we are awash with a population that is lonely, that is financially struggling, that is overworked, that is grieving. And we know that people are coming to see their GP with these problems. A study dating back to 2005 showed that up to 30% of all GP consultations contain some kind of psychosocial issue. Now, for me personally, it's not about turning people away. I don't ever want to hear myself say, sorry, that's not my problem. However, equally, it's not right to inappropriately medicalize all forms of distress and send people down the same track towards a mental health system that is admittedly under-resourced. The actual question for me, though, is not, should I be seeing this person in front of me with marriage difficulties? The question is, why has that person come to see me in the first place, their GP? Why have they got no one else to turn to? And it was this very question that prompted me to take time out of my GP training in 2016 and travel to a series of contrasting communities across the globe, searching for answers. Now, these locations were everywhere from rural Japan to the Scottish Orkney Islands. And in each of these communities, I totally immersed myself. I spoke to doctors, patients, community members. I joined local choirs. I learned to crochet. I wanted to really unpick what it was that made a good community, what it was that made a robust support network, what it was that made a good doctor-patient relationship, in order to try and better understand why it was that my community back in London was struggling to find support outside of the health system. Now, love and belonging rank really highly in Maslow's hierarchy of needs, and we know that to belong, we need to connect with each other. And to connect with each other, we need to share our stories and find resonance in the stories of others. For whatever reason, one of my main findings from that piece of work was that us, in our community, in my London community, and us in our wider society, we're not having enough of those everyday conversations. We're not finding authentic spaces to share our stories, and therefore we're not forging the connections that keep us well. But the good news is, this isn't universal. There are cultures around the world that are having these conversations and communities where storytelling is very much a way of life. And the native people of Alaska are one of these communities. And it was Alaska where I attended this conference in 2019. Now, it's really difficult when you go to Alaska, if anyone's been or anyone goes, it's difficult to not be awestruck by the nature, the landscapes. Everything is supersized. I remember on my first day there, I took a casual stroll to downtown Anchorage and encountered no fewer than 3 moose in that small journey. Now, I don't know if anyone's met these in real life, but nature doesn't really come any more supersized than that. It's also difficult not to be struck by the majesty of the Alaskan native culture. Alaska's a little bit unique in that because the state sits that bit away from the mainland US, the indigenous people there, although they have been touched very negatively by colonization, they have managed to retain a great sense of their culture. And that culture is built on the principles of storytelling, talking circles, and relationship building. Now, nowhere are those cultural values felt more strongly than at South Central Foundation, which is a solely Alaska Native health service built on the principles of storytelling and relationship building that has won 2 Global Health Awards. And this was the site of my conference in 2019. Now, despite knowing I was coming to the home of storytelling, I'll be honest, I turned up on day 1 feeling pretty jaded. I've got this in the bag, counting down the hours to lunch, and really feeling quite convinced I wasn't going to learn anything I didn't already know about conversation skills. Fast forward 3 days later, I find myself sitting in a talking circle with a group of people who'd been complete strangers only a few days before, sharing my life story in a way that I'd never shared before, feeling safe to do so, and feeling the greatest sense of catharsis. And I really was convinced that some kind of magic had occurred in those 3 days. So let me share now a little bit of that magic with you. I'd like to tell you a few things that I've learned that I think are relevant to us all as storytellers and listeners of stories, things that I hope you can take into your everyday lives, but also things that I think might play a part in solving some of these bigger problems that our population faces today. Firstly, sharing. There's an art to telling your story, and the key is to only go as deep as you want to go. The Alaska Native people call this swimming with the whales, going deep, or swimming at the surface, staying superficial. Now, in our culture, in our society today, we're told it's good to be open, aren't we? It's good to be vulnerable. And stories that are perceived as more traumatic, more painful, more difficult to share are often given higher value, particularly on platforms such as social media. However, if we don't share our stories within frameworks that are safe, we're in danger of oversharing or sometimes undersharing in ways that can be more damaging than they are beneficial. Next, listening. What is it to be a good listener? Well, of course, listening is about giving the person in front of you the time and space to share, but it's also about identifying and acknowledging the things that make it difficult for us to listen to someone's story. And the main reason that people find it difficult to listen to a story is fear. We're afraid of what we might hear. We're afraid that we won't know how to handle that information, or we won't know how to reply. And so we're inhibited. We don't approach, we don't ask that question, how are you? Think of all the times, I'm sure you can probably think of at least one, where we've walked past someone on the tube or on the street or at the bus stop who was visibly upset and felt that we couldn't go over because we might not know the right thing to say. And yet think of the difference we might have made if we'd had the courage to say, how are you? Perhaps the most impactful thing I took away, though, from my time in Alaska was this idea of giving a healthy response to a story versus an unhealthy response. Imagine for me, if you will, you're sharing your story with someone, perhaps for the first time, something quite difficult, and the person interrupts you immediately to share their own story. Or imagine you're sharing your story and someone interrupts to give you their bit of advice that they know will help. Or perhaps you're sharing your story and you become quite emotional and someone asks you to please stop crying. How someone responds to our story radically impacts our experience of telling it and undoubtedly influences whether we'll tell that story again. Now, these storytelling skills are learned and honed in Alaska Native culture in the practice of the talking circle. But talking circles aren't unique to Alaska Native culture. They're common practice in many Indigenous communities. And they serve in communities as a way of healing, as a way of resolving conflict, as a way of general celebration. At South Central Foundation, talking circles are actively integrated into the health system itself, and thus they provide a semi-formalized way of people getting support and for a community fundamentally to support each other in times of need. So, If we can acknowledge in our society and in this room tonight that maybe our conversation skills need a little bit of brushing up, a little bit of work, I want to propose that the model of the talking circle could be a way of doing that. And I don't say that because I want to appropriate someone else's culture or because I think it's the gold standard, but because the core values that underpin talking circles, that need to share, that need to listen, that need to be equal, these are core human values, values that we all share, and therefore talking circles could be something that benefits us all. I also want to propose that talking circles could play that vital part, could be that bridge between the healthcare system and community, and provide a safe, supportive peer space for people who are lonely, financially struggling, grieving, to get support. In order to help you visualize that a little bit, I wanted to share very briefly a project that I'm currently involved in that supports healthcare workers suffering with moral injury as a result of the pandemic. We've developed a remote restorative retreat program, which is based respectfully on Indigenous ideology and uses largely peer-based talking circles in order to provide a space for healing. And I'm very happy to say, so far, it's proving very successful. When we think about the future, we often think about progress or advancements in a linear fashion. What's going to be developed next? What's going to be new? But actually, when I think about the future of mental health care, particularly when I think about projects like the one I just mentioned, using talking circles, I think our future is actually less about the development of new technology, but about the relearning of old skills that we've lost. If you like, I think we have to come full circle. Sharing our story forges connections, and connections are what keep us well. Alongside being a GP, I work as a suicide prevention trainer. And within that training, I'm very privileged to share stories of people who've come very close to ending their life by suicide. And many of these people share the same message, almost universally, that in those final moments, it was someone approaching them and asking, "How are you?" that made all of the difference. So storytelling, it's not just about improving mental health targets or alleviating the burden on the NHS. Storytelling really can save lives. Thank you.